Are you thinking about using the type 2 diabetes medicine Ozempic? It can be scary delivering your first injection, but with the correct information and planning, you can prepare yourself for achievement. We are going to offer you helpful advice in this video to assist you get through the initial month of employing Ozempic and have a pleasant and productive journey. So, are you prepared? So, to clear up any questions, watch the video through to the finish. Let's take a moment to quickly define Ozempic and explain how it functions before moving on to the suggestions. Ozempic, also referred to as semaglutide, is a once-weekly intravenous medicine that is a member of the GLP-1 receptor agonist pharmacological class. By promoting the production of insulin, reducing metabolism, and decreasing hunger, it aids in lowering your blood sugar levels. Ozempic has been demonstrated to help type 2 diabetics lose weight and efficiently control their blood sugar levels. Let's now look at some crucial advice to help you succeed during the initial month of using Ozempic, so let's get started right now. Educating oneself. The first thing everyone needs is an elementary knowledge of the equipment they are employing. Start by completely understanding the procedure of Ozempic, any possible adverse effects, and appropriate injection methods. Ask all of your questions to your healthcare provider throughout your consultation. An educated perspective can assist you to feel less anxious and more comfortable during the entire procedure. Stick to the guidelines. So now the second thing that should be done is to stick to the guidelines. Pay attention and listen to your healthcare providers and the medicine's packing directions. Pay careful consideration to the quantity, injectable site, and dosing schedule that is advised. Ask your physician for more information if you are uncertain. Prepare equipment. Prior to your first injection, compile all the required equipment. The Ozempic pen, single-use needles, cotton wipes, and the container for sharps for secure disposal are included. Everything should be available right away to make the procedure more convenient and efficient. Select injection location. The most crucial step is selecting the ideal location. Usually, Ozempic is delivered via injection into the upper arm, thigh, or belly. Spin the injection locations to promote maximal absorption and avoid irritability. Don't inject near bruises, scars, or current infections of the skin. Put good injection technique into practice. Become proficient in proper injection technique by carefully washing your hands and disinfecting your injection site using an alcohol wipe. Place the tip of the needle at a 45-degree angle by pinching a fold of skin or as directed by your medical professional. Use the drug as directed, injecting it slowly and steadily. To make sure that every substance is injected, keep the incision in place for a few moments after the injection. 6. Monitor glucose levels. The most important component of this procedure is to monitor your glucose level. Regularly check the sugar levels in your blood during the first month of treatment. This will enable you to determine whether Ozempic is successful and whether the diabetes treatment strategy needs to be modified. During subsequent appointments, offer the doctor a copy of your reading journal. 7. Be careful of negative effects. Ozempic may cause negative effects, just like any medicine. Nausea, vomiting, diarrhea, or modifications to appetite are a few of them. These negative effects are typically transient and get better with time. For advice, if your complaints are severe or ongoing, speak with your healthcare practitioner. 8. Develop a routine. In order to maintain regularity, include your Ozempic injections in your normal daily routine. Decide on a time and day which works best for you, then keep to it. In order to create a regular timetable, using smartphone applications or setting notifications can be useful. 9. Maintain hydration. When using Ozempic, it's important to drink enough water. Dehydration can be avoided, some adverse effects can be less likely to occur, and general health can be supported. Unless your doctor advises otherwise, try to drink a minimum of 8 glasses of water every day. 10. Look for support. Last but not least is looking for help. Having diabetes might be difficult, but you cannot afford to go through it alone. Contact online forums and support groups for people with diabetes. This will surely help you. Ozempic is exclusively obtainable under its brand name. However, there are lots of ways to cut costs and lower the cost of your prescription. They consist of patient support programs and copay reduction cards. For more information, consult your healthcare professional or chemist. Without a doubt, diabetes is quite difficult. However, persons who have diabetes must be strong and combat the disease. While we are here to help you all the way through, it's equally essential to see your doctor for medical attention. If you have any questions, please don't hesitate to post a comment below. Moreover, if you enjoyed the video, be sure to subscribe to the channel for additional useful materials. Thank you for watching.